Welcome all. Today we will speak about coronavirus in cats.
Causes FIP. All things considered follows sickness of a feline coronavirus, which ordinarily doesn't expedite any outward reactions. It is acknowledged that there are a couple of sorts of coronaviruses that change into the feline overpowering peritonitis, either in solitude or as the delayed consequence of a blemish in the cat-like's protected response. Also tangling the issue is that a coronavirus can lie slow in a cat-like's body over months before changing into FIP. The FIP disease by then debases the white platelets, using them as transportation to assault the entire body. Diagnosis. This ailment is truly it of the fact that FIP can emulate different infections. This is particularly valid for the dry structure. There is no single research facility test accessible that can point definitively to FIP, however your veterinarian might have the option to make a hypothetical analysis dependent on lab discoveries. A total blood include may show changes in the quantity of white platelets, WBCs, and this will demonstrate that a contamination is available, however it may not be clear what disease is available. While an ELISA or IFA test will show the nearness of coronavirus antibodies, it can't recognize the kind of coronavirus, or even whether it is the reason for your feline's condition, just that your feline has been in contact with the infection and has created antibodies to it. The degree of antibodies isn't an indicator for your feline's vulnerability for building up the malady. There are additionally hardly any progressions found in an organic chemistry profile testing. Progressively explicit testing might be utilized by your feline's veterinarian, including a polymerase chain response, PCR, test, which may separate the remarkable DNA of the FIP infection, yet once more, this frequently just shows that the infection is a coronavirus, not what type it is. Your pet's veterinarian may take test of liquid from stomach or thoracic hole for additional assessment. In some hard-to-analyze cases, stomach medical procedure might be required for analysis. Generally, veterinarians base their decisions on a procedure of differential conclusion, by which the veterinarian is guided by a more profound assessment of the outward indications, precluding every single other illness as the conditions are not and all side effects point to one explicit malady more than others. Treatment. This disease is difficult to treat and requires incredible consistent thought. With the non-abundant structure, treatment may be given using cat against contamination specialists, threatening to inflammatories, and immunosuppression of the disease spread. This isn't a fix, yet a way to deal with make your cat progressively pleasant and to draw out its life by 2 or 3 months. Your veterinarian may decide to oust a mast fluid from the pits to diminish pressure too. If your cat has the open kind of FIP, there is commonly no possibility to get of treating the indications in any significant way, as the disorder spreads too rapidly. The general conjecture for affected cats is poor, which seems, by all accounts, to be convincing and generally extraordinary to disarrays. Living and management. Unfortunately, this affliction passes on an awful speculation for impacted cats. Simply solid treatment can given. Your veterinarian will offer you a couple of proposals for making your cat pleasing, yet just as can be normal be looked for after is several months of additional time. Any treatment that is given is suggested particularly to mitigate the symptoms of the illness, there is no fix. At the point when your cat has been resolved to have this pollution, it has passed the period of contamination and it isn't critical to separate the cat from the rest of the nuclear family. With everything taken into account, the most ideal approach to shield your cat from this powerful affliction is to practice routine refinement of your cat-like's living domains, sustenance/water utensils, and nooks. It is fundamental to separate new litters of little felines from various cats, not their mother, to hinder contact with this, or some other, disease. In case the mother is found to have been polluted, expelling the little felines won't improve their chances, since by then they have recently been introduced to the contamination. Without a doubt, the antibodies in her milk may shield them from tainting while they are close to nothing. Besides, owners should constrain their indoor cats from heading outside. Since the FIP disease can debase making hatchlings, You should discuss this with your veterinarian before replicating your cat. There may be counteracting agent available, or in any occasion, a test that can tell you whether your cat is passing on a coronavirus.